So I think those are the main things that I wanted to highlight here. I'm happy to delve in more detail with particular topics or questions that come up. I think the big takeaways for medullary thyroid cancer are number one, this is a rare type of thyroid cancer that develops from, rather than the usual thyroid cells that make thyroid hormone, from the parafollicular or C cells of the thyroid gland, which have a different function. And that is where medullary thyroid cancers develop from. I think number two, the second takeaway is that medullary thyroid cancer can either be sporadic, meaning we don't know why it developed and there's not a clear reason, but can also be associated with a germline risk or familial risk of developing medullary thyroid cancer, and that this can also be associated with a condition called multiple endocrine neoplasia, or a syndrome associated with risk of not only medullary thyroid cancer, but other endocrine tumors as well. And that a detailed evaluation in that situation by a cancer geneticist and a cancer risk clinic, as well as by an expert thyroid endocrinologist, is very, very, very important. In terms of, I think, number three, it's very important that this evaluation for medullary thyroid cancer, because of how rare it is done by an experienced multidisciplinary team that sees a high volume or very large volume of medullary thyroid cancers and thyroid cancers overall, because this is a rare cancer type that really needs that type of expertise and that access to multidisciplinary approach to optimize outcome in terms of getting the right imaging done, getting the right genetic testing done, making sure that all the right parties and stakeholders in the treatment plan are involved to make a good shared treatment plan decision making for a particular patient. And then four is that we have many drug therapy options, pill form therapies that are used now for advanced medullary thyroid cancer that are progressing. These are targeted therapies, so we do genetic testing on medullary thyroid cancers because identifying whether there is a RET mutation is very important, because there's now drugs that are specifically targeted towards that particular mutation, which is quite common in medullary thyroid cancer, as well as other potential targets to help figure out what the best drug option is for an advanced medullary thyroid cancer that warrants treatment for a particular patient. And then the last takeaway that I think is really important to highlight is clinical trials. For rare diseases, the importance of clinical trials in developing and identifying better treatments, better therapeutic approaches, especially for rare cancers, is so, so, so important. And so going to a high volume center where clinical trials are available for medullary thyroid cancer patients is really, really uh, critically important. And that's an important part of improving the current treatment paradigms for this rare disease. So hopefully this was helpful. And again, if you have any questions, feel free to reach out to me. Thanks.